I asked my staff or my coworkers to come up with questions, but let me ask you this. How's the vaccine rollout going?
The vaccine rollout is going well, but I want it to get better every day. And that's what we're striving for, is to increase the numbers of vaccines that get into the arms of our Kansans. And so I just had a vaccine meeting on it before I'm doing this interview. We're at about 60% level for the vaccines that we have that are in the arms of our Kansans. We want that number to go up, but it's a little bit challenging because some of those are set aside for second doses. Whenever you look at how we're doing, I check it every day just in my competitive nature, and we're in the top 15 in terms of the states that success in getting the vaccines out. But we just want to do better and look for better ways to do it every day, limited by the supply. And if we had all the supply of the vaccine that we needed, then we would get the vaccines out within a week. But the fact is it's a limited supply, so we cannot do it that fast, and there has to be a priority process.
When you read the national media, one of the problems that's cropped up with the vaccine rollout was, we can get the vaccine to the states, but the states don't have the money. I'm thinking of New York State, what I read, I think they were $20 billion in the hole. They don't have the money to execute getting the vaccine into the arms of people. How is Arkansas doing on that score?
We're doing fine. That's not an impediment for us. We actually had, through this last COVID relief package, additional funds that came for vaccine distribution. So that's not an obstacle. And we also have access to the National Guard that can assist us as needed if we had a mass distribution vaccine facility or event. But it's all about supply. If we had additional supply, we have the resources, we have the funds, we have the capacity to get it out. Now, longer term, down the road, there will be some costs whenever you get to vaccinate 1 million people. We will have some additional costs that are involved there. But right now, it's not an issue, and that's not going to be a difficulty for us. We just need more supply of the vaccines.
Do you know how much we've got coming?
Yes. So they're telling us every week as to what we can expect for the next 3 weeks. And so last week we were informed that we were getting a 16% increase in our vaccine supply. This week I received notice that we're getting an additional 5% increase in our vaccine supply, and both of those are good for 3 weeks. In terms of Arkansas, that's probably 6,000 or 7,000 extra doses every week that we're getting. But we also are looking at utilizing Walmart as a distribution capacity, and they'll be getting a separate 10,000 in a couple weeks. And so, but those are improved numbers, but they're still limited numbers. Whenever you look at 50,000 doses compared to 3 million population in the state, we are going to have a lot more doses.
That brings up the relationship between you, Arkansas, and the new administration in Washington, the Biden administration. Correct me if I'm wrong. My sense is there's more focus than there was with the previous administration. I'm not asking you necessarily to compare it, but can you see a difference is my question. Can you see a difference now than what you were seeing, say, 3 months ago?
In terms of vaccine distribution, no. Both administrations were singularly focused on getting the vaccines out. And so that has been very focused on both administrations. I said earlier that the process has been seamless, and what I meant by that is that the Trump administration was focused on it, the Biden administration has been focused on it, and the handoff has been very good. And so from a state perspective, the supply was not interrupted, the communication continues to be at a high, excellent level. The partnership, the cooperation. Jeff Zients is the director of the Biden Coronavirus Task Force. He called me personally, a one-on-one call just the other day, and that's helpful, that kind of communication. I've got his cell phone number, he has mine.
Wow. Your biggest frustration through all this is a battle we're in. We're fighting war, and we're now almost at the 1-year anniversary. Your biggest frustration, what's it been, Asa?
the length of it, and that's been the strain, I think, on all Arkansans, is that, we're all prepared. We can mentally handle a 1-month ordeal, an emergency. 2 months is challenging. It gets into 3 months, it gets tedious. Here we've been close to 1 year, and that has just worn on everyone. It wears on leadership, the Department of Health, our medical doctors, and our healthcare professionals particularly. So the length of it is the biggest challenge that we all face. Now, let me be a little bit more optimistic here, because you talked about vaccine supply. I'm very excited about the future, because one of the things that if Johnson & Johnson can get approved, which I believe it will, they're already manufacturing their vaccines. So they'll be ready to distribute as soon as they get their FDA approval. That will give us the third vaccine supply, increase those numbers significantly. All of them are going to start producing more. So I'm very optimistic that in the next couple months you're going to see an increased supply of that. And once we get the vaccinations out, I think it gives everybody greater hope, and they can start seeing the end of this.
What about the new strains? Does that bother you?
There's a curve every day, and yes, it does. Just like yesterday, I lifted the curfew for our bars. Obviously, if the new variant gets here, and it might be already here, we've got to be extra careful, and because it is a more highly contagious variant of the virus. So the key thing is that we have to have hope, but at the same time, we have to have discipline and not get careless about our behavior, because it is our behavior that really has given us some success in slowing down the new cases.
Slowed down a little bit in the past couple of weeks, hadn't it?
Both the cases have been reduced, but also the hospitalizations. And if you remember, I had my winter COVID task force, in which we're putting resources into expanding our ICU beds. We saw the need for the future, that we could have a strain in terms of our capacity. And thank goodness, because of behavior, because of discipline, you're seeing not just the cases go down, but our hospitalizations have gone down very significantly. And that takes a lot of pressure off of our healthcare workers, our hospitals, as well as those that have family members that have to be cared for.
You got your eye on another opening? You've expanded, gone back to the bars, not having to worry about closing at 11. Have you got your eye on another releasing of restrictions? Is there another domino about to fall?
Well, you look at the restrictions that are in place right now, and it is primarily that our restaurants, our indoor venues are limited to 2/3 capacity. And that's a hardship on our businesses, and I'd love to see us back wide open, but as long as we're having to social distance, and in that environment, you have to take your mask off to eat, and so you have to have the distance between the tables. So naturally, that limitation is going to be needed for some time. Now, as soon as we get the vaccinations out, hopefully we can lift that, but we're basically wide open in Arkansas, except for some of those limited indoor restrictions, and to make sure that we can comply with those public health guidance.
When we first talked, it was about testing. You kept your eye on that number. The second time we talked, you kept your eye on, you were telling me your number one was hospitalizations. Now I have a hunch you're keeping your eye on the vaccinations.
Oh, it absolutely is. Every day I have my vaccine report. I have my meeting with the Colonel Ader and Secretary Romero about vaccine distribution. We're looking ahead right now to 3 weeks down the road. We're looking ahead to when Johnson & Johnson comes online. How could we accelerate our distribution of this, make it easier on everyone? We're looking at the data also to make sure it's equitably distributed around the state. So it's not just in the urban centers, but it's in our rural areas, and that we cover our state fairly. And that is very important, but it's still an additional layer of challenge for us.
My wife read to me that one thing you do not do now is when you're around people say that you got the shot, because that will immediately incense people over shot envy. I also have a hunch that you're getting a lot of messages and calls from people now about where is it, where's my shot. Is that eating up your phone lines?
It is. I mean, people are very patient and they're very fair-minded about it. They understand the limitation on capacity and the supply chain, but they still want the vaccine. And so you've got two categories. Somebody who's 70 and plus that can qualify it for now, they're anxious to get it and they might be in line. For a while, they really didn't know how to get the vaccine. Now they know, and so that system is working better, and I sense that they are getting that shot. We'll help you get yours.
Give me some advice. Well, give me some advice. We have signed up with a small pharmacy in the Heights, Smith's Country Club drugstore. We've been with them for over 40 years, best friends, and yet you feel like they're on the very tip end of the tree, that the vaccine's getting headed off by all the other. And so my wife and I just sit and wait for them to call. Give me some advice.
Well, absolutely. And so if you go on our Department of Health website under vaccines, then vaccine information, you'll see a list of all the pharmacies, hospitals, clinics that offer the vaccines. And you can go on any one of those and sign up. Now, we do encourage, and you've been good, you've only went on one, but if you're down the road sometime, it's fair for you to try to get on a shorter list and to try to see where the best opening is. And then the key is, once you get that, you get your shot, make sure you call back to the other one to take your name off the list. That way, somebody else can take advantage of that. But you do have to, for example, Baptist Health, is getting doses every week. You're getting the pharmacies, multiple pharmacies in Central Arkansas that get doses every week. And so they will plan and get those out, but there's a lot of different opportunities for you, Craig.
Well, using the celebrity name hasn't helped so far. I may drop your name. This is going to air Super Bowl night. It's going to have a huge audience. Finally, what do you tell Arkansans? They've been tuned into the Super Bowl. We've all been brought together. What do you tell us going forward in this battle against COVID-19?
Hang in there, just like we always do as Arkansans. We fight through the tough times. And I know this has been challenging from everybody from school children to the elderly that can't hug their grandchildren. And so let's work hard. I think the priority is get your vaccination whenever it's your turn, and you can get that. And then secondly, make sure we continue to socially distance and wear a mask. If you're at a Super Bowl party right now, take a look around. I hope that y'all are following the guidelines of being careful, because we don't need what we had after Christmas and New Year's, which was the cases going up.
What junk food do you have at your Super Bowl party?
Well, I'd love to have my jalapeno duck poppers. That's a pretty good start for Arkansas.
Oh, well, I see some questions here, but I think you've answered all of them. Maybe we haven't gone here with this, and I think I can probably answer this.
I got 2 more points. I got one more important
Go
point
ahead.
to cover, which is sometimes people ask, well, what's the cost of the vaccine? And I want everybody to know that if you go in to get your vaccine, they're not going to charge you to get the vaccine. Now, if you have insurance, if you've got Medicaid, they're going to take that information and they're going to bill that to get reimbursed, because there is a cost for the pharmacy or hospital to do it. But if you don't have the cash, if you don't have insurance, you can get that vaccine. And we want to make sure everybody understands that if somebody is saying, well, you've got to pay us money up front to get it, we'll bill Medicaid, we'll bill the insurance company, but we want you to get the vaccine.
Do you have a date on the calendar circled in which you hope vaccines will be in at least 60 or 70, 80% of Arkansans? Or do you even dare do that?
No, I don't have that date circled, and that would be very, very speculative right now, because I don't know what the supply is. I have predicted or hoped that we would get through our essential workers in 2 months, and you think about that's probably 400,000. And so that shows you the scope of the challenge that we face and how the supply is so critical for it.
What about you personally? Is there a date in your head? For instance, my wife and I love going to Hawaii. We can't even begin to think of getting on that plane, going to Honolulu, maybe not even in the winter of 2022. Do you think that is there something like that that is in your head?
Yes, you're right. I would fully expect that we'll be able to travel in the summer and late summer. We can travel now, but I think everybody will feel very much more comfortable doing it with the extent of the vaccines that are out. I expect next year to be a much more normal school year. I need a vacation at some point, and I'm hoping that that's going to happen, in the fall for sure.